the greatest achievement of the injury and violence prevention community over the last decade or so has been the contribution of putting prevention of injury on the map.
One of the major accomplishments that we've had in the last 10 years has been the bringing together of research and practice, and I think this meeting has been a real, very emblematic of that.
I think one of the greatest improvements over the last decade has been our capacity to capture really rich qualitative and quantitative data on deaths through both Child Death Review and through the National Violence Surveillance System.
We, in the last 10 years, we kind of learned from more developed countries how to prevent injuries and violence.
I think the greatest achievement in injury prevention is that in the last 10 years we actually do know what works, what it takes to make people safe.
Applying multidisciplinary approach to injury prevention research and practice.
I think one of the best achievements over the last decade of the injury prevention field is how safety has become a sales component in the product world. For instance, cars are now advertising safety aspects of their vehicles as a sales tool, and I don't think that used to be the case.
We have to find a way to sell ourselves. We have to find a way to change the culture. We have to bring more students in, we have to bring more money in, and we have to use the media to change perception.
In the next 10 years, I think that we really need to look at the integration or the collaboration of many different associations together.
I think we still need to get the word out that injuries are a winnable battle, and that means engaging our leaders, community partners, schools, parents, children themselves in injury prevention efforts and partnering with them in developing effective programs for the future.
I think we can't underestimate the impact that research has on policy development and policy implementation.
We know we have so many campaigns, but they are so separate. I mean, there are groups of individuals with common goals, but there is a huge need for a strategy, like a national strategy.
I think looking in the future, I think AACN systems, technology, using injury algorithms to predict injuries from crash data is going to be the most important thing.
I think the most important focus for the next 10 years of injury prevention is raising awareness globally. We need to make sure every country understands the importance of injury prevention activities and that the major elements of government and health, safety, transportation are all working together to prevent injuries.
The most important thing in the future for injury and violence prevention is the continued work for translating the science into practice. And I think the more that those two communities merge and work together, the better the field is going to become, the more effective the field of injury and violence prevention is going to be.
So I think for the future of injury prevention in the field, we really do need to be better at communicating what injury prevention, what the field is all about, and how important it is, the work we do. But I also think it's really important that we bring new people into the field.
My passion is the youth and actually engaging them and being a part of the solution. Many of times in public health we talk about collaboration and we talk about the different industries to collaborate with and just the different components of the public health system. But in my experience and the work that I do with violence prevention, a core component of that is engaging the youth.
Looking at putting solutions in place and looking at health promotion in the workplace alone is not sufficient. It's important to understand that the worker has non-workplace factors that are affecting what happens in the workplace, and I think there needs to be an integration of those two.
Well, going to the future is convincing everyone in America that violence is preventable and the injury is preventable, and that there's something that is not inevitable, that this has to happen, that you get hurt, even when something goes wrong.